Hey, Golden Vitality family. Did you know there's no magic age to stop masturbation for better senior health? But there are smart times to adjust in today's video. We'll reveal the health signs that matter and how to stay safe, comfortable, and confident in your self-care routine. Stay tuned. This is essential wisdom for aging well. Hello and a very warm, heartfelt welcome to you from your friends here at Golden Vitality. We are so pleased you're joining us for this conversation. We believe that aging is a journey rich with wisdom and opportunities for continued well-being. And part of that journey involves talking openly and honestly about all aspects of our health, including topics that might feel personal or haven't always been easy to discuss. Today, we want to gently address a practical question with care and respect. Are there times when older adults should consider adjusting or perhaps even stopping their masturbation habits? Our goal is to provide clear, compassionate guidance focused entirely on health, comfort, and individual well-being, free from judgment or assumptions. This is about empowering you with information, not telling anyone what they should do. As always, while we aim to offer helpful general insights, please remember your health situation is unique. This conversation is never a substitute for personalized advice from your own doctor or trusted healthcare provider, who knows you best and is your most valuable resource for any health concerns. Life in our 60s, 70s, 80s, and beyond often brings a welcome shift in perspective. We might find deep joy in activities like tending a garden, watching life unfold in nature, sharing laughter and wisdom with grandchildren, contributing our time and skills through volunteering, or simply immersing ourselves in a good book or pursuing a lifelong hobby. Maintaining our physical and emotional health allows us to continue enjoying these activities that bring meaning and richness to our days. Part of maintaining overall well-being includes acknowledging our physical selves and our needs for comfort, connection, and pleasure. For many people, sexual feelings and the capacity for sexual expression, including self-pleasure, masturbation, continue throughout life. Masturbation, the act of stimulating one's own body for pleasure, often leading to arousal and sometimes orgasm, is recognized by health professionals as a generally normal, safe, and potentially beneficial activity for many adults of all ages. We've talked before about how it doesn't cause harm or weakness based on outdated myths, and how it can potentially help with stress relief, sleep, mood, and body connection. So, the question isn't about reaching a certain age where one must stop. Age itself is not a reason to stop masturbating if it brings you comfort or pleasure and causes no harm. Instead, the question becomes, are there specific circumstances, usually related to health, comfort, or personal well-being, where it might be wise or even necessary for an older adult to adjust their habits, pause the activity for a time, or perhaps stop altogether? The answer is yes. There certainly can be such situations. These are almost always tied to specific physical or emotional factors, not simply the number of candles on your birthday cake. Let's explore these potential circumstances with sensitivity and practical advice. The key here is often about adapting rather than necessarily stopping completely, unless specific health risks dictate otherwise or it no longer feels right for you. 1. When physical pain is present. This is perhaps the clearest signal that something needs to change. Masturbation should feel pleasurable or comfortable. It should never cause significant pain. If you experience pain during or persistently after self-pleasure, it's your body telling you to pay attention. Potential causes: vaginal dryness, atrophy in women due to lower estrogen after menopause. Vaginal tissues can become thinner, drier, and less elastic, making friction painful. Skin irritation, tears being too rough, especially on delicate older skin, or inadequate lubrication can cause soreness, chafing, or small tears. Infections, urinary tract infections, UTIs, yeast infections, or other genital infections can cause pain upon touch or during arousal/orgasm. Specific conditions like lichen sclerosis, a skin condition affecting the genitals, vulvodynia, chronic vulvar pain, or certain types of prostatitis, prostate inflammation can make stimulation painful. Musculoskeletal pain. Certain positions might aggravate arthritis, back pain, or hip pain. Underlying medical issues. In some cases, pelvic pain could signal a more significant underlying issue that needs medical evaluation. What to do? Stop the activity immediately if it causes sharp or significant pain. Try adjusting, be gentler. Use ample lubricant, essential for many women. Change positions to avoid stressing joints. See your doctor if pain is new, severe, persistent, or accompanied by other symptoms like bleeding, discharge, urinary issues. It's crucial to get it checked out. Don't ignore pain. Your doctor can help diagnose the cause and recommend appropriate treatment or management strategies. It might be something easily solvable, like using lubricant or treating an infection, or it might require more investigation. 2. During recovery from recent surgery or medical procedures. If you've recently had surgery, especially involving the abdomen, pelvis, groin, spine, heart, or genitals, your body needs time to heal properly. Why adjust, pause straining muscles, increasing abdominal pressure, or vigorous activity, including the muscle contractions of orgasm too soon, could potentially interfere with healing, cause pain at the surgical site, increase the risk of complications like reopening an incision or causing internal bleeding. What to do? Always follow your surgeon's specific post-operative instructions regarding physical activity restrictions. These guidelines usually include advice on when it's safe to resume sexual activity, partnered or solo. If unsure, don't hesitate to ask your doctor or surgeon during a follow-up appointment when it's safe to resume self-pleasure. Be patient and gentle. Even when cleared, start slowly and gently, listening carefully to your body during the recovery period. 3. In the presence of certain severe or unstable health conditions. While masturbation is generally safe cardiovascularly, often comparable to mild exercise like climbing stairs, there are situations involving severe health conditions where any physical exertion needs careful consideration and medical guidance. Focus on heart health. This is the primary area of concern. If you have been diagnosed with unstable angina, chest pain that occurs unpredictably or with minimal effort, uncontrolled high blood pressure, severe heart failure, certain serious heart rhythm problems, arrhythmias, have had a very recent heart attack or heart surgery, why caution is needed. Sexual activity causes a temporary increase in heart rate and blood pressure. In these specific unstable conditions, this exertion could potentially trigger dangerous symptoms like severe chest pain, dangerous arrhythmias, or excessive strain on a weakened heart. What to do? This is crucial. You must have an open conversation with your cardiologist or primary care doctor before resuming any sexual activity, including masturbation. They need to assess your specific condition and stability and advise you on what level of physical exertion is safe for you. Do not guess or assume. Your doctor's guidance is paramount for your safety. For most people with stable, well-managed heart conditions, sexual activity is often considered safe, but only your doctor can confirm this for your specific situation. Other severe conditions, while less common, perhaps during an acute phase of another severe illness where any exertion is advised against, pausing might be sensible. Again, doctor's advice is key. During acute flare-ups of certain genital or pelvic conditions. If you have a condition that affects the genital or pelvic area, direct stimulation might sometimes need to be paused during acute flare-ups. Example, acute prostatitis, especially bacterial ejaculation, can be very painful and potentially worsen inflammation during an acute infection. Active genital herpes outbreak. Touch can be painful and potentially spread the virus to other areas or prolong the outbreak. Severe yeast infection or UTI stimulation might increase irritation and discomfort significantly. Painful flare of lichen, sclerosis or vulvodynia. Direct touch might be intolerable during a bad flare. What to do? Follow your doctor's specific treatment plan and advice regarding activity during flare-ups. Listen to your body. Avoid direct stimulation if it significantly increases pain or irritation during these acute phases. Focus on non-genital comfort. If seeking relaxation, focus on other methods. Deep breathing, warm bath, gentle touch elsewhere until the flare subsides. 5. When physical limitations make it unduly difficult or risky, leading to adaptation. Sometimes, physical changes don't necessitate stopping altogether, but require significant adaptation to remain safe and comfortable. If adaptation isn't possible or successful, then stopping might become the practical choice. But adaptation should usually be explored first if the desire remains. Challenge it. Severe arthritis / pain making necessary positions or hand movements impossible without causing significant pain. Extreme mobility issues. Difficulty reaching genital areas safely or maintaining a stable position. Neurological conditions. Conditions affecting sensation or motor control might make stimulation difficult or potentially lead to injury if sensation is impaired. G2. Applying too much pressure without realizing it. What to do? Focus on adaptation first. Experiment extensively with positions and pillows for support. Utilize assistive devices. Vibrators or massagers with ergonomic handles might overcome hand dexterity or reach issues. Focus on easily accessible areas. Pleasure isn't limited to direct genital stimulation. Seek partner assistance if applicable and desired. If manual dexterity is the main issue, a willing partner might assist. If adaptation fails, despite trying these methods, the activity remains consistently painful, overly frustrating, or feels unsafe due to lack of control or sensation, then choosing to stop might be the most sensible course for well-being. 6. If it causes significant emotional or psychological distress, health isn't just physical, your emotional and mental well-being is paramount. Situations. Overwhelming guilt or shame if, due to deeply ingrained personal, cultural, or religious beliefs, the act consistently causes profound feelings of guilt, shame, or self-loathing. Forcing yourself to continue is not emotionally healthy. Association with trauma. If self-pleasure triggers distressing memories or feelings related to past sexual trauma, severe anxiety. If the act itself, or thoughts about it, provoke significant anxiety, what to do? Honor your feelings and values. Your emotional peace matters. If the activity genuinely conflicts with your core beliefs or causes deep distress, respecting that boundary is a form of self-care. You have the absolute right to choose not to engage. Seek support if desired. If the distress stems from negative messages you wish to overcome or from past trauma, talking with a therapist, counselor, or spiritual advisor could be incredibly helpful. They can help you process these feelings and make choices aligned with your desired well-being. But the choice to engage or not remains yours. 7. When medication side effects significantly interfere, leading to discussion, not necessarily stopping. Some medications common among older adults can affect sexual desire, libido, arousal, or the ability to achieve orgasm. Impact. This might make masturbation feel less rewarding, more frustrating, or physically difficult. G. Difficulty maintaining an erection. What to do? Don't automatically stop the medication. These drugs are often crucial for managing serious health conditions. Talk to your doctor. Explain the side effects you're experiencing. Sometimes, they might be able to adjust the dosage, switch you to a different medication within the same class that has fewer sexual side effects, Suggest timing adjustments, though often difficult with long-term med. Offer treatments for side effects and GI, medication for erectile dysfunction if appropriate. Reevaluate desire. The discussion might lead you to decide that if the desire isn't strong due to medication effects, you're okay letting the activity go for now. Or you might want to pursue medical options to counteract the side effects. The key is open communication with your doctor to understand options. It's less about the masturbation itself being problematic and more about managing the medication's impact. Reframing, adaptation, and choice are key. Notice that many of these situations point towards adjusting habits rather than outright stopping. Adjusting technique, being gentler, changing focus, adjusting position, using pillows, finding comfortable alignments, adjusting tools, using lubricants, employing assistive devices, adjusting timing, pausing during acute illness or recovery, choosing times when you feel better, adjusting expectations, accepting natural changes in response. The decision to stop completely often comes down to a few key factors. Persistent pain when adjustments don't alleviate significant pain. Direct medical contraindication when a doctor explicitly advises against it due to a specific, serious health risk like unstable heart disease. Insurmountable physical barriers when limitations make it consistently impossible or unsafe. Despite adaptation attempts. Significant emotional distress when it causes more harm than good to your mental well-being or conflicts with core values. Lack of desire, simply losing interest, which is perfectly okay and requires no justification. The importance of open communication with your doctor. We've mentioned this throughout, but it bears repeating. Your doctor or healthcare provider is your confidential partner in health. Don't hesitate to bring up concerns related to sexual function, comfort, or safety. They are trained professionals who deal with these issues routinely and respectfully. Be prepared to discuss any pain you're experiencing, changes in sexual desire, arousal, or orgasm, how your health conditions might be impacting things, concerns about medication side effects, questions about safety related to your specific health profile. They can offer personalized advice, perform necessary examinations, recommend treatments or aids like lubricants or vaginal estrogen for women, adjust medications if appropriate, and provide crucial reassurance or guidance based on your individual needs. Your body, your choice, your timeline. Ultimately, the decision about whether, when, and how to engage in self-pleasure is deeply personal. There is no universal rulebook, no age limit, no external should or should not that dictates your private choices. The situations outlined above are simply guideposts based on health and well-being considerations. They highlight times when pausing to listen to your body, seeking medical advice, adapting your approach, or perhaps choosing to focus your energy elsewhere might be the wisest and kindest thing to do for yourself. It's about honoring your body's signals, respecting your emotional landscape, and making choices that align with your overall health, comfort, values, and desire for a fulfilling life. Whether that includes masturbation, now or in the future, it's entirely up to you. The power lies in having accurate information to make those choices confidently and safely. Think of it like maintaining a beloved car. You don't stop driving it just because it's older, but you do pay closer attention to its signals. You address strange noises, pain. You take it easy after repairs, surgery. You ensure it has the right fluids, lubrication. And you follow the mechanic's advice, doctor's guidance for specific issues. You adapt your driving style to keep it running smoothly and safely for as long as it serves you well. Thank you for joining us at Golden Vitality for this sensitive but important conversation. We hope this discussion has provided helpful clarity and reassurance, emphasizing that decisions about masturbation habits in later life should be guided by individual health, comfort, and personal choice, not by age alone. Listen to your body. Communicate openly with your healthcare providers about any concerns, and feel empowered to make choices that support your holistic well-being, physical, mental, and emotional. If you have persistent pain, concerning symptoms, or questions related to your specific health conditions, please do schedule an appointment with your doctor. They are there to help you navigate your health journey with confidence and care. Be well, take good care of yourself, and continue to embrace life with vitality and dignity.